pulmonary edema. Pulmonary edema, fluid go dey your lung, fluid, malaria fit do am. You go make fluid dey your lung. You never know malaria. Because sometimes, if you dey sick, you no dey go hospital. Malaria fit spoil your kidney. Malaria, e fit spoil your kidney. Now let's talk about malaria. Malaria is an infectious protozoa disease that is transmitted by female Anopheles mosquito. Malaria is not caused by female Anopheles mosquito. Malaria is caused by a parasite called Plasmodium falciparum. Plasmodium falciparum. So, not be female mosquito, not be dey cause malaria. But na the female mosquito, na dey carry the parasite dey waka. If this female Anopheles mosquito bite us, e inoculate the Plasmodium parasite into our body. The parasite will now went straight to the liver cells. Now, where our liver dey, the mosquito, female mosquito, e go bite us. The parasite go come enter our body. E go come go where our liver dey. E go come dey suck blood. E go come dey burn. E go come many. E go come enter our blood. That time we call dey see say headache come dey come. So na this female mosquito na we dey see for inside house. Male mosquito cannot be seen inside your house. You no dey see am for inside house. Àìmí ewo wa mosquito yìí pè àìmí wọn. Ọyún kù ọ̀rọ̀ àmì yẹn. Ikú wọn wà ní ọgbìn. Now, female Anopheles mosquito carries this malaria parasite. The male mosquito na inside this thing for the see am inside potopoto. All those swamp areas wey be say if you see say sometimes you yourself go see say all those mosquitoes wey get tiny hands and legs, they will perch on top of water. They will perch all those erosion water. They are the male mosquito. Now they be the male, not be the female. Now that female that dey make noise for inside house. Now we get many parasites wey dey cause this thing. We get Plasmodium falciparum. Now that one na just concern us, especially Nigeria. Na just concern Nigeria. We have Plasmodium vivax. That na for Asia malaria. Plasmodium malariae na Asia. Plasmodium knowlesi and Plasmodium vivax. So there many. But one wey concern us na Plasmodium falciparum. Plasmodium falciparum. Plasmodium ovalis still dey o. But that one no concern us. But one wey concern us na Plasmodium falciparum. Na dey cause severe malaria for this country. Now, wetin be the signs and symptoms if you get malaria? Because this malaria divide into three. We get asymptomatic parasitemia, we get acute malaria. Acute mean say something wey go just come suddenly before you know wetin dey happen, before any treatment e don comot. Sometimes if you no even treat am sef, e go disappear due to your immune system wey dey fight am. Then we come get severe malaria, the uncomplicated one. Asymptomatic malaria mean say you get malaria for body, you no know say you get am. Why? Because you no dey get the signs and symptoms. Your mouth no dey bitter, you no dey vomit, and you dey eat well. So na so e be. Now, let's talk about the signs and the symptoms of malaria. Number one, headache. You go get headache. Malaria. If malaria don bite you, your body don dey hot. Fever. Because a normal fever is na e no suppose pass 36.6 to 37 degree when your body dey suppose dey. But if you don dey sick of malaria, your fever come go 39. You go come go this 39, you go come high. You go come dey feel headache. Then from there your mouth go come dey bitter you. Bitterness of the month. Bitterness of the month. Your mouth go dey bitter you. Then join this. Join this. Especially newborn baby. Newborn baby, if you born am, you go see say the baby eyes e dey yellow. The skin of the baby e dey yellow. So na be jaundice. Na malaria dey cause am. And another thing still dey wey dey cause am o. That one na hepatitis, liver problem. Na still dey cause am. But malaria na still dey cause jaundice, no be only malaria. Then nausea. This nausea mean say you get urge. You go be like say you wan vomit. You go dey do say you wan vomit, but you no fit vomit. Na be nausea. Or you go dey vomit. Then pallor. This pallor mean say pain. Pain. Your hands, your palm, your eye, e go dey white. Blood no dey because of malaria. Excessive sweating. You go dey sweat for night. Another symptoms, you go dey sweat for night, na malaria fit dey cause am. Then if malaria don severe, e don severe without, I don mention all this sign now, e don come severe and you no see symptom, e go give you hypoglycemia. Hypoglycemia mean say low sugar level in the body. To the extent your sugar come low, they go come dey find sugar wey they wan give you, and malaria dey cause am. And sometimes the injection wey they go use, one of the injection na quinine. One of the side effects is quinine, of quinine is low sugar level, also known as hypoglycemia. Na be side effect. So another symptoms, severe anemia. Malaria fit reduce your blood for body, your blood level, you go reduce am. Malaria. The other thing, hemoglobin. Malaria fit still make am say if you piss, your urine go come dark, e go come be like Pepsi or Coke when you dey drink. You see as the way the Coke bottle dark, if you piss, your urine go be like that. Why? Because malaria don too many for your body. The bacteria don too many, the parasite. Now, circulatory collapse. This circulatory collapse, you dey shivery, your body go dey shake, your hands and your feet, your leg, e go cold. Then they tell you say, don dey go, na be that one o, na malaria dey do am o. Then another one, see febrile seizure. Febrile seizure. This febrile seizure means convulsion in child. Baby, momo, e go dey convulse. Baby, e go dey convulse all the time. E go dey convulse. Na malaria dey do am. Na severe malaria na dey do am. And that thing, if you no treat am, if baby continue like that, dey convulse, e go lead to epilepsy. The baby fit get epilepsy, is likely to have epilepsy in future. Malaria fit do am. Na that one dey call cerebral malaria. E go come enter the brain. Impaired consciousness. Impaired consciousness means restlessness. You go turn come this side, you go turn come this side, you go dey restless. You know, dey comfortable. Na malaria dey do am. Weakness of the body. Weakness of the body, tiredness of the body. You go dey weak. You go dey tired before you do anything, you don tire. And malaria dey do am. Another thing, she or rago. That's why you go dey shake like this. Come go dey your body, she or rago. You go full am. Ache and body pains, all your muscles, all your body go dey pepper you, all your joints. Na malaria still dey do am. Typhoid still dey do am, and some other disease. Pulmonary edema. Fluid. This one na severe one, and na one of the complications of malaria be this. Pulmonary mean say lung. That's what they call pulmonary, lung. Edema mean swelling. E come swell. That be edema. Fluid go come dey your lung. If that fluid dey your lung, you no go fit breathe, you no go fit lie down, you go dey restless. That is pulmonary edema. Now, repeated vomiting, severe malaria. Repeated vomiting. This repeated vomiting, in the morning you go vomit, in the afternoon you go vomit. Any small thing wey you eat, you go still dey vomit. Na severe malaria dey cause am o. That time your mouth don dey bitter. Then prostration. This prostration mean say restlessness. You go dey, you no get power, you go weak. This time you no fit get up by yourself. Na person go dey carry you dey waka. Say abeg make we rush am go hospital because e don dey weak. Na be prostration. Hepatosplenomegaly, or you call am hepatosplenomegaly. This hepatosplenomegaly mean say enlargement of the spleen and the liver. Hepa mean liver. Sto mean and spleen for inside belle. Na dey call ude. The Benin people dey call am ude. Belle go come swell, baby belle. And still dey do adult, e go come swell, e go big. Na be ude. They go come dey mark belle. No, that one na tradition. You no suppose to dey mark am. Na malaria and typhoid na dey cause that thing. Then another thing wey still dey cause am, when the signs and symptoms of malaria, abnormal bleeding, epistaxis. E can make you to bleed from your nose. You go dey bleed from your nose. Malaria fit do am. Malaria fit spoil your kidney. Acute renal failure. E go give your kidney infection if you no treat malaria. Hyperparacytemia. Hyperparacytemia mean say Too many parasites don dey your blood o. Too many parasites don dey your blood. This time e fit lead to complication o. Because na only 5% of parasites na dey affect us. Now, wetin be the mode of transmission now? How we take dey get this malaria? We want to talk about early complication. Early complication in malaria. If malaria dey do you and you no treat am, early complication. Low birth weight. Low birth weight. Because your normal baby weight when if you newborn am 2.5 kg to 3.5 kg, you no suppose pass. E no suppose big pass 3.5, e no suppose low pass 2.5. Because if e come low pass 2.5, that means e low, e come go low birth. Then if e high pass 3.5, that's what they call microsomic baby or microsomia. That one sometimes baby dey big, some people dey born normal, e go big pass 3.5 kg. But sometimes if person get diabetes, a woman wey get diabetes, that their baby dey usually dey big, low birth weight. Then intrauterine growth retardation. Intrauterine growth retardation. Malaria fit no make that baby grow well for your belle if you get belle. Intrauterine fetal death. Malaria fit kill that baby for your belle if not treated. Congenital malaria. This congenital malaria, the malaria be say the mother fit give baby during pregnancy. Malaria fit cause abortion if you not treat am. Miscarriage, malaria can cause miscarriage if not treated. Malaria can cause pneumonia. E go come give you problem for lung. E go come give you problem for your lung. One of the early complications like that one. Malaria fit still give you infection of the blood, septicemia. Early complication. Now, malaria fit still make your belle, you wan wey get belle, go be like say you wan born. Go dey do you like say baby wan come down. Sometimes you go dey contract. Your womb go dey contract, go dey do like say you wan born, but the time never reach. And malaria fit still make your baby to come down. You go born premature. Malaria fit still do am. Malaria if not treated, severe one. Now you no come treat am. These are the complications you no treat am. Organ failure. Organ failure. Malaria e fit spoil your liver, e fit spoil your lung, e fit spoil your kidney if you give am time. If you give am time. The other one, hypoglycemia. E go reduce your sugar level for your body. You go dey weak. If sugar dry for body, the person go become dundee. Sugar dry for your brain, the person go become dundee. Severe anemia, e go reduce your blood. Malaria fit still do am. E go spoil kidney. Cerebral malaria, this one dey make person dey kolo. This one na dey cause epilepsy. If you give am time, e go cause epilepsy. Cerebral malaria, e go enter your head, e go behave abnormal. Now we don come for that. If you wan do test wey you suppose do if you get malaria, you go do MP, malaria parasite test. Malaria parasite test. Now you go do malaria parasite. Then you fit do blood semen or weather test or vida test. Now let's talk about the management. The management of malaria. Clear the bush around your surrounding. When I dey clear my bush, clear your environment. All those dirty water wey dey your compound, wey dey wash pot, sometimes you go eat, you go leave pot for there. You know, water go dey inside. All those things they are